Early child care and education in Connecticut is a patchwork system. It's made up of a mix of public programs and private small businesses. There is no national coordination on policy or funding, and funding comes from all levels of government, federal, state, and local. So you see a lot of variation in the availability, affordability, and quality of early child care across the state. And like any other system where cost, quality, and access can vary, you see many issues with equity throughout. 70% of households with children under the age of 12 need childcare in order for parents to go to work, but the cost can be prohibitively expensive for families. For low-income families, public subsidies do exist to help pay for childcare, with the largest in Connecticut being Care for Kids, but there are significant barriers to accessing the subsidy. And when the cost of childcare exceeds what families can pay, people have few options beyond relying on family, taking on debt, or leaving the workforce. This means that the burdensome cost of early care works to deepen racial and gender inequities. So many families that struggle to afford childcare are not eligible for Care for Kids. To be eligible currently, first-time applicant families have to have income at or below 50% of the state median income. Those reapplying have to make 65% of the state median income or less, and undocumented families are completely ineligible for Care for Kids. Families must also pay a family fee of between 2 and 10% of their income, which can be a lot for families that are already struggling. Care for Kids vouchers aren't just inaccessible to many families that need support, but they also don't cover the cost of high-quality early child care. So a model that I constructed in the State of Early Childhood report shows that a child care program in Connecticut serving 26 kids cannot operate on Care for Kids alone, even when providing the lowest levels of quality and staffing. So in order to serve low-income families, programs have no choice but to cut back on services or provide really inadequate resources to their own workers and staff. So the pandemic showed everyone what early child care advocates have long known, which is that child care programs are a vital part of our workforce infrastructure. When the pandemic caused almost all programs to close temporarily and some permanently, unfortunately, families struggled to work, care for, and educate their children all at the same time. And with women primarily responsible for childcare, working women with children really struggled. And in mid-March of this year, women still accounted for 60% of all new unemployment claims in the state. So this past year has underscored just how essential universal access to quality early child care is to our state. A strong early child care system allows Connecticut families to work and contribute to our communities. It also provides our children with safe, healthy, nurturing environments where they can grow and thrive. So it's estimated that each dollar invested in high quality early care and education can generate between $7 and $12 in overall economic benefit through decreased need for social services and increased employment income. So a 2019 study of 133 social policy changes over the last 50 years suggests that investments in the health and education of low-income children may yield the highest returns in terms of future earnings for its participants. If Connecticut wants to help families recover from the devastation of the pandemic, affordable, accessible, high-quality early child care and education must be central to the solution. In order to create the early child care system that we need, there are a few key steps that the state needs to take. So in the short term, Connecticut should assess the real cost of high quality early care and education based on a cost study and secure resources to fund it and ensure continued resources for access, quality, and stability beyond the initial pandemic recovery period. So in the long term, the state should focus on working with the federal government to make early care and education truly affordable by permanently suspending Care for Kids family fees for families living in poverty, expanding eligibility, and establishing mechanisms to ensure that no family pays more than 7% of their income for care. The state also needs to broadly define quality in partnership with families to ensure that priorities are based on evidence and respond to real community needs. To learn, why don't we just say go to the website?
Yeah,